Hello, my juniors. Welcome to a continuation of the arterial blood pressure. So here we'll be talking about the regulation of the arterial blood pressure. So if you are here now, instead of you watching this one, go back to the introduction to the arterial blood pressure and work your way to this side. Are you getting me now? So even though you have not watched that one, you can start from cardiac output and do it here because they are more or less just the same thing. So this one will be talking about the regulation of the arterial blood pressure. So if you are just new here, make sure to subscribe and turn on your post notification button, so at any time I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make that video for you. So we are talking about the mechanism of arterial blood pressure. So how can blood pressure to be regulated homeostatically? So when there's increase, what can cause a decrease? And when there's an decrease, what can cause an increase? So we can regulate the arterial blood pressure in three ways. We have a short-term mechanism or a short-term regulation, we have a medium-term regulation, and we have a long-term regulation. Are you getting it now? So very important. So we have a short-term regulation, medium-term regulation, and long-term regulation. The body can control the blood pressure shortly with neural. Are you getting now? Where the autonomic fibers release neurotransmitters. So let's say if we are talking about the short-term regulation of it, so how can the body regulate it in short term? Your body can regulate your blood pressure short term neurally, which means the nerve fibers will be releasing some particular neurotransmitters in order to increase and decrease arterial blood pressure. Okay now. So first of all, before we go deep into the short-term regulation neurally, let us know the component in the brain that helps to regulate this blood pressure. So let us know the centers in the brain. So the vasomotor system. The vasomotor system is a system in the medulla that will regulate arterial blood pressure. So it is a center in the medulla. So we call it the vasomotor centers. And we have three centers. We have the cardioaccelerating center. Cardioaccelerating, which means its work is to accelerate the heart, contract it, increasing everything. We have the cardioinhibitory area, the one that helps you to inhibit action. And we have the sensory area. Are you getting that? In the vasomotor center in the medulla. So we have the cardioaccelerating, cardioinhibitory, and sensory area. So if we are to start with the cardioaccelerating, because we are regulating the blood pressure for a short time. So maybe there's a problem now, maybe there's a blood loss or there's a fever, something that just happened now. To regulate your blood pressure acutely, now, you have to use the neural method, which is the neural mechanism. So first of all, what is the cardioaccelerating center? The cardioaccelerating center is called the pressors. The work cardioaccelerating. The work is to increase cardiac output, increase heart rate, increase blood pressure, increase everything. So where are they located? They are located in the lateral portion of the vasomotor center. Are you getting me now? Which is located in the medulla at the floor of the fourth ventricle. So if they ask you where the cardioaccelerating center, also called pressors, is located in the lateral portion of the vasomotor center. So if you have the vasomotor center, the lateral portion of the vasomotor center is called the cardioaccelerating area, which is located at the floor of the fourth ventricle. And what does it do? Constrict the blood vessel to increase blood pressure. So if it contracts, are you getting now? You increase heart rate, increase stroke volume, increase cardiac output, and now increase blood pressure. Are you getting now? So cardioaccelerating. Are you getting cardioaccelerating? Sympathetic fibers releases norepi for contraction of the heart, and releases epinephrine for the contraction of the heart, and norepinephrine for the contraction of the blood vessel. So these two increases heart rate, stroke volume, cardiac output, and arterial blood pressure. So you get it now. Cardioaccelerating, accelerating to sympathetic fibers to increase blood pressure by vasoconstriction. Cardioinhibitory, it is not called pressors, it's called depressor. So cardioinhibitory inhibits movement. It doesn't want cardiac output, it decreases everything. So it's called depressor. Now as cardioaccelerating is located in the lateral portion, is located in the medial portion. So cardioinhibitory medial portion, cardioaccelerating lateral portion. The work is to do vasodilate. So you can vasodilate the blood vessel to sympathetic means, because sympathetic has different receptors. Are you getting now? You have alpha receptors, beta receptors. Alpha receptors is where norepi binds to, while beta receptor is where epi binds to, epinephrine. So two beta 2 receptors. When epinephrine binds to beta 2 receptors, it vasodilates the blood vessel. So you can vasodilate the blood vessel to beta 2 receptors and alpha 2 receptors. Also parasympathetic nerve. So when acetylcholine is also released, you also decrease blood pressure. So anytime the cardioinhibitory is signified, anytime it is signaled, the work is to just reduce the blood pressure. But anytime the cardioaccelerating center is stimulated, your work is to increase blood pressure. So cardioinhibitory area releases parasympathetic fibers, vasodilation, decreasing blood pressure. So now the work of the sensory center. The sensory center does two things, which is the nucleus of tractus solitarius. The work is to do two things, to either stimulate the cardioaccelerating or cardioinhibitory. I get it now. So the work is to stimulate cardioaccelerating or cardioinhibitory. Cardioaccelerating increase blood pressure through sympathetic means. Cardioinhibitory decrease blood pressure through what? Parasympathetic or sympathetic means. So sympathetic is to beta 2 receptor, while parasympathetic means the release of acetylcholine. So don't forget, it's straightforward. Parasympathetic decrease blood pressure, beta 2 receptor of sympathetic also decrease blood pressure. So beta 1 and alpha 1 of what sympathetic increases blood pressure to cardioaccelerating center. So cardioaccelerating sympathetic, cardioinhibitory sympathetic, and parasympathetic. While sensory center, nucleus of tractus solitarius, its work is to stimulate cardioaccelerating cardioinhibitory. I get him now. It's located in the posterolateral aspect of the medulla and the pons. I get him now. And the work is to stimulate either cardioaccelerating cardioinhibitory. So now what happens now? We have three short-term regulation, three neural. So I've given you the centers. So since I've given you the centers, so we want to do three reflex that help us to increase or decrease arterial blood pressure. So three reflex. In your exam, they tell you how can you regulate it in short term. You can use three reflex. You have the Baroreceptor Reflex, you have the Chemoreceptor Reflex, and we have the Artrial Reflex. So Baroreceptor Reflex, Chemoreceptor Reflex, and Artrial Reflex. So don't forget it. So I'll be giving you the pathway, which is very, very important. In Baroreceptor Reflex, first of all, what is stimulating Baroreceptor Reflex? I get it now. Baroreceptor Reflex can also be either an increase in blood pressure or a decrease in blood pressure. So either an increase in blood pressure will stimulate baroreceptor, a decrease in blood pressure will also stimulate baroreceptor, but the prime stimulator of baroreceptor is increase in blood pressure. So increase in blood pressure stimulate the baroreceptor reflex. Are you getting now? So for now, always remember now that your baroreceptor, when time there's increase in blood pressure, say take for instance now your heart is beating too much and you are releasing blood very fast, so immediately the baroreceptor are located in the carotid sinus and the aortic arc. Don't forget, keep it down. Baroreceptor is located in the carotid sinus and the aortic arc. The carotid sinus is located in the what? In the bifurcation of the what? Common carotid artery at what? The upper border of the thyroid cartilage. So that dilation there, that's why you have the carotid sinus. Are you getting it? And that carotid sinus, it has a pressure receptors that anytime there's an increase in blood pressure, what happens is to stimulate it and send the information to the brain to decrease the blood pressure. Are you getting now? So when there's an increase in blood, also when there's a decrease in blood pressure, it will just inhibit the baroreceptors. Increase in blood pressure stimulate baroreceptors to bring down the blood pressure, while decrease in blood pressure inhibit baroreceptor, because baroreceptor is primarily stimulated by increase in blood pressure. So when my blood pressure is increased, my body look for baroreceptors when the blood is going to the brain to help me to send an information to my vasomotor center to decrease blood pressure. So how can this happen now? First of all, we have, let's say we have increase in blood pressure. So when there's increase in blood pressure, blood is moving to the arc of the aorta, because in the arc you have one baroreceptor there, and when you now move to the carotid arteries, you are now moving to the carotid sinus, you also have a baroreceptor there. So immediately it stimulates the baroreceptors. What will the baroreceptors do? It will send afferent signal to the glossopharyngeal nerve and vagus nerve. We have afferent fibers of glossopharyngeal nerve and vagus nerve. Immediately, high pressure stretches the baroreceptors. You know, I told you that the baroreceptor are located in carotid sinus, and the carotid sinus is very dilated. So when the blood is moving to that and there's stretching of the carotid sinus, immediately the afferent fibers of glossopharyngeal nerve and vagus nerve will send an information to the vasomotor center. But which part of the vasomotor center? The sensory area. of the vasomotor center, which is called the nucleus of tractus solitarius. So when it sends an information to the nucleus of tractus solitarius, now it will peak. Now it is receiving information of increase in blood pressure, so it has to decrease the blood pressure. So instead it will not stimulate cardioinhibitory center. So it doesn't want to, because there's increase in blood pressure, I can't stimulate but cardioaccelerating center, because I'll only be increasing blood pressure the more and busting the vessels. So the head is that if I stimulate the nucleus of tractus solitarius, which is the sensory area, it will peak the cardioinhibitory area. So the cardioinhibitory area's work is to decrease the blood pressure. So the cardioinhibitory area will send parasympathetic nerve and sympathetic nerve. If you send parasympathetic nerve will send acetylcholine, which will drop the blood pressure by vasodilating the vessel. Sympathetic nerve will send epinephrine, which bind to beta 2 receptor, and norepi, which bind to alpha 2 receptor. What do? They will vasodilate the blood vessel, dropping the blood pressure. Again, an increase in blood pressure stretches the carotid sinus. So when blood is going up towards the brain, if it gets to the carotid sinus, it will stretch the wall of the carotid sinus and immediately to be stimulated, sending afferent signal to the glossopharyngeal nerve and vagus nerve, to the where? To the sensory area, which is the nucleus of tractus solitarius. So when it gets to the nucleus of tractus solitarius, to decrease it will stimulate by cardioinhibitory center. And the cardioinhibitory center will now send efferent parasympathetic and sympathetic to your heart and blood vessel to drop the blood pressure. So the next one here is the chemoreceptors now, which is the switch, because if increase in blood pressure stimulates baroreceptors, why decrease in blood pressure will stimulate chemoreceptors. So anytime there's decrease in blood pressure, how is there decrease? Let's say a patient is having shock whereby the patient have lost blood, or sepsis, or allergy, or the patient has a underlying neural condition that is over stimulating parasympathetic nervous system and inhibiting sympathetic. So anytime there's the reduction in blood pressure caused by any of these parts, whereby vomiting, decreasing your blood volume, or whether hemorrhage or burn, or surgical, after surgery, maybe there's a complication, sepsis, any of this drops your blood pressure. And when they drop your blood pressure, immediately, anytime your blood pressure is dropped, your oxygen level also drops. Take for instance, you are losing blood to bleeding, and as you are losing blood to bleeding, all your blood has gone, which means your red blood cell is already reduced, and if your red blood cell is reduced, your oxygen level have dropped. You're hypotensive already. And as you're hypotensive, what happens immediately? Remember, oxygen goes into the tissue, CO2 comes out from the tissue into the blood to be expired away. So take for instance, there's now drop in oxygen. What will the body have? The body will have increase in CO2, because naturally the body has acid. So there will be increase in CO2 and increase in what? Hydrogen ion, cause acidosis. So there's hypoxia, hypercapnia, and acidosis. Are you getting now? So these components stimulate the chemoreceptors. So the chemoreceptors, where are they located? In the carotid body and the aortic body. But the baroreceptors are located in the aortic arc and the carotid sinus. So immediately when this decrease in oxygen, increase in CO2, and acidosis stimulate the chemoreceptors, are you getting now? What happens? Immediately, what will happen now? So now when there's a drop in blood pressure, hypoxia, hypercapnia, acidosis, immediately my body stimulates my chemoreceptors in the carotid body and the aortic sinus. So this one now will still send the same thing. Afferent signals of glossopharyngeal nerve and vagus nerve. Remember, the stimulating factor was a decrease in blood pressure. So when I stimulate my receptors, it will send an information to the nucleus of tractus solitarius. So if I send my information to the nucleus of tractus solitarius, just like that one, in baroreceptors, the prime stimulation was increase in blood pressure. So I will stimulate cardioinhibitory because I want to drop the blood pressure. But now that I want to increase the blood pressure, I'm not stimulating cardioinhibitory. I will stimulate cardioaccelerating by increasing the release of sympathetic fibers. So as sympathetic fibers will release norepi for the blood pressure, norepi for the blood vessel to increase blood pressure, and epi for the heart to increase what? Cardiac output, heart rate, arterial blood pressure. Don't forget, when your blood pressure drop due to what? Acidosis, hypoxia, hypercapnia, what happens? Your body sends afferent signals. Are you getting that? From the chemoreceptors to the nucleus of tractus solitarius using your glossopharyngeal nerve and vagus nerve. So when you send it to that side, your nucleus of tractus solitarius will stimulate your cardioaccelerating center. When they stimulate it, cardioaccelerating center has primarily sympathetic nerves where they will now send the information to where the heart and blood vessel, and the purpose is to increase blood pressure. So the next one is arterial reflex, atrial reflex. Atrial reflex is in the wall of the atrium. Are you getting it now? So how? So this one too is stimulated by increase in blood pressure. So take for instance, there is increase in venous pressure. Increase in venous pressure, like I always taught you, increases what? Venous return. So let us say for instance, there's increase in venous return very well, and there's increase in venous return, increasing blood to be dropping into the right atrium. So when the blood pressure is high and the venous pressure is high and the venous return is high, there's something called the arterial natriuretic peptide, AMP. Don't forget, arterial natriuretic peptide. The arterial natriuretic peptide is located where? In the right atrium. So since it's located in the right atrium, its work is to dictate increase in what? Venous return. So when there's increase in venous pressure to the IVC and the SVC, blood enters into the right atrium. So the right atrium will stretch. If the right atrium stretch, what happens? It will stimulate arterial natriuretic peptide. When it stimulates arterial natriuretic peptide, what happens? It will now, the same thing, sends afferent signal, not through the glossopharyngeal nerve now, only afferent signal from the vagus nerve to the nucleus of tractus solitarius. So when it gets to the nucleus of tractus solitarius, who do we want? There's increase in blood pressure already due to increase in venous pressure, due to increase in venous return, due to stretch in the right atrium. So the right atrium is signifying the AMP to send afferent signal to the nucleus of tractus solitarius. So I'm calling Cardioinhibitory Center. So the Cardioinhibitory Center will send information to parasympathetic and sympathetic to the blood vessel and nerve to do what? Decrease blood pressure. So baroreceptors is stimulated by increase in blood pressure and also decrease, but majorly by increase in blood pressure, stimulating cardioinhibitory to cool it down. Now arterial reflex also the same thing. Due to increase in venous return, stretching of the right atrium, AMP is stimulated. If AMP is stimulated, it sends an afferent signal to the vagus nerve, to the NTS, which is nucleus of tractus solitarius, which send afferent signal to the where? To the cardioinhibitory center, which makes you to decrease your blood pressure. So we have talked about short-term regulation, which is baroreceptor reflex, chemoreceptor reflex, atrial reflex. Medium-term regulation. What is medium-term regulation? We have two methods. We have the hormonal method and we have the capillary shift method. You have the hormonal method and you have the capillary shift method. I get it now. In the capillary shift method, what happens? Don't forget, in the capillary shift method, what happens? So anytime there's hypovolemia, take for instance, during shock, like I told you, during hypovolemic shock, when you are bleeding, you are burn, or you are vomiting, you are stooling, something that is decreasing your blood volume, or you are anaphylactic, or you are septic, any of these conditions that vasodilate the blood vessel, causing all the fluid to enter into the tissue. So what will happen here? At this particular point, there will be hypovolemia. So when there's hypovolemia, what happens? Your body will go into hypovolemic shock. So to recover all these things, are you getting me now? Because when all these things happening, your body go into hypovolemic shock, cortisol will be released, and when cortisol is released, it will be released from the adrenal cortex, also releasing histamine and what? Prostaglandin. So the work here is that during capillary shift, we want to shift its fluid from the tissues to the blood to compensate for the hypovolemia. So we want to increase the ECF volume. So how can you increase the ECF volume? By shifting fluid. Because here at this particular point, there will be increase in osmotic pressure in the ECF. And anytime there's increase in osmotic pressure in the ECF, fluid will be moved from the ICF to the ECF. So for capillary shift method to compensate and to increase blood volume due to a decrease in blood volume causing hypovolemic shock, the body will now say 30 twice to shift fluid from the tissue into the blood, which means there will be decrease in capillary pressure. So if there is a decrease in capillary pressure, fluid can move directly from the tissue into the blood. Don't forget. You get it now? So this cause now, because remember I tell you when there's an increase in blood volume, increase in blood volume increases blood pressure, which means the body tends to compensate because there's already blood loss, there's already fluid loss. So the body compensates. Due to this fluid loss, there will be increase in solute in the blood due to a decrease in blood volume. So that increase in solute will create an osmotic pressure, causing that there should be fluid migration from the tissue to the blood. Are you getting me now? So now another one is the long-term regulation, because we'll be joining the hormonal regulation with the long-term regulation, because hormonal regulation is the medium-term regulation, but some part of the long-term regulation also have hormones that are also hormonal. So we'll not talk about hormonal personally. With the long-term regulation, you have hormones that also can be medium-term. So medium-term hormonal can also join with long-term regulation. In long-term regulation, over a long period of time, after neural regulation have saved the patient and capillary shift method have kept the patient till help comes. In long-term regulation, over a period of weeks, months, what happens? The kidney begins to regulate blood pressure. How? To what we call Renin-Angiotensin-Aldosterone ADH system. So in this method, what happens? Always just listen. In this method, here, renin, due to a decrease in blood pressure, low cardiac output, immediately the body will start secreting renin. Are you getting now? Immediately there is decrease in blood pressure, the glomerular cell of the kidney will start releasing water, renin. And when you release renin will now convert angiotensinogen to angiotensin 1. Renin will convert angiotensinogen to angiotensin 1 using what we call renin synthase. So renin synthase will convert angiotensinogen, which is located in the liver, to angiotensin 1. Are you getting now? Now angiotensin 1 travels to the lungs where there's ACE, angiotensin converting enzyme. Again, angiotensin 1, which was produced in the liver, travels to the lungs. Are you getting me now? So when it travels to the lungs, what happens? There is an angiotensin converting enzyme here that converts angiotensin 1 to angiotensin 2. So now the angiotensin 2 is very, very important. It's very, very important because it helps regulate your blood pressure for a long time. So angiotensin 2 will go to many places. Are you getting me now? So first of all, it will go to the posterior pituitary gland. Angiotensin 2 will bind to angiotensin 2 receptor on the posterior pituitary gland. Do you know what it's doing? It wants it to release what we call the ADH that was stored there temporarily, because ADH is produced by the magnetocellular cell of the hypothalamus. Are you getting me now? So the magnetocellular cell of the hypothalamus secrete ADH, store it in the posterior pituitary gland. So now it is stored in the posterior pituitary gland. What the angiotensin 2 receptor do? Angiotensin 2 receptor binds to the receptor in the posterior pituitary gland to release ADH. So when you release ADH goes to the distal convoluted tubule, the late distal convoluted tubule. When it goes there, it binds to the receptor there. Are you getting now? Which is the aquaporin receptor. When it binds to the receptor there, it opens out the ion gated channel so that water can leave the kidney into the blood. So ADH, to increase blood pressure, you have to increase the ECF volume, which is the blood volume. So when you increase blood volume, you increase blood pressure. How? By what? Releasing ADH binding to ADH receptor in the distal convoluted tubule. When it binds there or in the collecting duct, what does it do? It opens up the aquaporin channel for the water to leave from the kidney to the blood. Also, angiotensin 2 binds to angiotensin 2 receptor in the zona glomerulosa. So when it binds to the zona glomerulosa, aldosterone will be released. Are you getting me? So if aldosterone release, aldosterone will travel through the blood and go to the kidneys. When it goes to the kidney, they will bind also to the late distal convoluted tubule. When it binds to aldosterone receptor in the late distal convoluted tubule, the work is to open up the sodium channel. So when you open up the sodium channel, sodium will be reabsorbed into the blood. So aldosterone binds to aldosterone receptor in the late distal convoluted tubule, opening up the sodium channels for the influx of sodium into the blood. So when there's sodium influx into the blood, water will also go. That will increase sodium content in the blood and also water content. This will also increase blood pressure. So don't forget, ADH binds to aquaporin channel in the collecting duct or in the late distal convoluted tubule, which does what? Open up the aquaporin channel. We have aquaporin channel type 1 and type 2. So when you open up the aquaporin channel, what happens? Water will go into the blood. Also, aldosterone binds to the aldosterone receptor in the blood in the late distal convoluted tubule. Then this open up the sodium channel for the influx of sodium into the blood. Also, angiotensin 2 also does what? Binds to the adrenal medulla, releases what we call norepi. So norepi also go to the blood vessel, causing contraction. Again now. So angiotensin 2 we also release norepi from the adrenal medulla. I get him now. Angiotensin 2 we also maintain glomerular filtration rate. Why? By regulating. I get him now. So if it reduces a little the efferent arterioles, reducing the size of the diameter of the efferent arterioles, keep the solute in the capillary, therefore increasing what? GFR. So for you to increase GFR, you have to increase blood pressure. But excessive blood pressure decreases GFR. I get him now. Majorly, it is increase in blood volume, increase in cardiac output, but not drastically increase in blood pressure. I get him now. So blood pressure is important too. Also, your angiotensin 2 also binds to the hypothalamus, the lateral hypothalamic nucleus. So when it binds to the lateral hypothalamic nucleus, the same thing will happen. It will increase what we call taste. So you have to drink water at this case. So the increase in taste you are increasing is to drink water. So when you drink water, the water will enter the kidney and will still be reabsorbed by these people. You get it now. So this thing is very, very easy. You get it now. It's a very, very easy and we have understood it. So angiotensin 2 increase water reabsorption to ADH. Angiotensin 2 increase sodium reabsorption to aldosterone. Angiotensin 2 reduce peripheral resistance due to increase of norepi. I get him now. Also, they bind to receptor in the hypothalamus, lateral part of the hypothalamus, which is the lateral hypothalamic tract. Increase test makes you drink water replenish the fluid and what? Increase your blood pressure. I get him now. So there are also many hormones that you can talk about. There are so many hormones. You can still talk about histamine prostaglandin. The vasodilate the blood vessel, dropping the blood pressure. You have tyrosine increase the blood pressure. You have adrenaline, dopamine, all of them increase the blood pressure. So these are hormones that are all in this category. So I hope it all made sense to you and you have understood everything I've talked about in the regulation of arterial blood pressure. So if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I don't promise I'll make that video for you. So we'll be moving to the next item on the playlist, talking about the regional circulation. We start with the cerebral circulation, talk about the fetal circulation, then talk about the coronary circulation. So always keep watching my video, keep sharing it to everybody. Bye bye.